Tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Now, here's John and today's guest.
Thank you for joining me on Recovery TV. The numbers are getting worse. We're losing Rhode Islanders every day. My guests today are from the Governor's Overdose Task Force, Ms. Kathy Schultz and Tommy Joyce. Welcome you both to the show today. And I want to talk about the Governor's 2030 plan. I know both of you sit on it. Kathy, you're a director. So I don't know who wants to go first, but the floor is yours.
So the Governor's Overdose Task Force actually has its own strategic plan, and what we're doing is we're actually aligning with the Governor's 2030 plan. So I can speak directly to the Governor's Overdose Task Force strategic plan, if you'd like me to give a little bit of information on that. So basically, as we've done since 2015 with the Governor's Overdose Task Force, we still have maintained our 4 pillars. We've expanded on some of those pillars as well. So we have our prevention pillar, we have our rescue and our harm reduction pillar. We expanded rescue to include harm reduction. We still have our treatment and we have our recovery. In addition to that, we also have a racial equity that is embedded across all of the pillars. We're now looking more deeply into social determinants of health because we know how important that is and how that drives, especially in recovery, treatment, and all of the pillars. And everything that we do is focused. Basically, our action is focused on data and the surveillance systems that we have, and we look at as we're putting our resources out into the communities.
You know, one of the things, too, that's been very helpful is these vans that are going out. Kodak has one, Tri-County has one, especially for primary care and other diseases that people may have, diabetes, heart conditions and stuff. Has there been any conversations with the governor about the state buying one of these vans and utilizing it in, i.e., the 95 complex or Central Falls, or where the heat of the overdose issue is? I don't know. Has there been any conversations about that?
With the governor itself, I have not had conversations with the governor's office on that, but we do know that the Kodak van, as well as the Tri-County van, we also have our homelessness providers who also have the Shower to Empower, are actually placing in many of the hot spots across the state, including offering to go into some of our hotel areas, our community-based, our FQHCs, such as Thunder Mist. I know that they're in West Warwick Thunder Mist. They're working with Community Care Alliance in Woonsocket. They're in Project Weber News parking lot a couple of times a week. So we do know that we are targeting those hot spots with the vans, the mobile units that we have.
I think it's a good point, though, because if you look at it, behavioral health is healthcare. So I think what you kind of touched on is that what they call integrated services. But really, behavioral health and physical health should be in the same arena. And so those vans should be out there, too, working with the behavioral health providers and going through there to increase people's wellness. I think that's the goal, is to get people well in Rhode Island and get them better. We have these silos set up that have been around for a while between behavioral health and physical health. And I think we should take those down and concentrate on wellness and realize that, behavioral health is healthcare, just like medical health care. And when we have that parity, I think people will get better. Yeah,
and the other thing, too, is if we had more primary docs that do like ride-alongs like Gateway does with the police and fire, maybe have primary cares in these vans, and if people get their medication, whether it's high blood pressure, diabetes, and stuff like that, it wouldn't make them feel a lot better than scrambling from one town to another town to another town, go downtown, and then they get on a bus and they go somewhere else. I mean, it's almost, it's a perfect storm what's going on right now.
So I do know that I've had a lot of conversations about street medicine and about really increasing street medicine. One of the wonderful things is that there was a recent press release about getting nurses out, what we're calling mobile medical respite,
Right.
and getting nurses out working directly with our harm reduction and recovery outreach teams, as well as homelessness providers, to bring the services out into the community and work, whether it be in the drop-in centers or even possibly to just go do outreach with them and meet in a central location across the state. So you're right, I absolutely agree with you. I think it's really important that we get these resources out into the community in that way. The good news is here in Rhode Island, we really are doing that type of work. We do have mobile units across the
Right,
state.
right.
We're also now increasing to specifically for wound care because we know that xylazine is an issue and that we're seeing wounds.
Yeah.
So even at this point, years ago, Rhode Island had a big push on recovery-oriented systems of care, the ROSC model, which is reducing these barriers for people seeking services, whether it's for behavioral health or physical health. And I think what you just touched on too, again, is reducing those barriers and bringing services to where people are actually at. Because I know professionally, from my experience, is that you can make a referral, but the chances of that person leaving your space and getting to the next level or the next position they want to go to is, those odds go down. But if you actually can provide resources where they're at, you'll see it'll be more effective.
And I got to say this: if I owned an insurance company, if I owned one, I would definitely take a certain percentage of bucket money and put it into the middle of this problem, because ultimately, my rates and my expenses will go down if these people are getting help, because they're not in the emergency rooms all the time. I mean, there was headlines this weekend. We're taping in September. There's headlines this weekend about Rhode Island being one of the top states in the country of people with the backup in the emergency rooms. I mean, I was visiting a friend a few weeks ago, and it was a 9-hour wait in Hasbro. I mean, that makes no sense to me. Makes no sense to me. But people don't have primary care. The docs that are in primary care either retired or moved out because our payments are horrible in Rhode Island. And now you got weight on top of weight on top of weight on top of weight. And you guys are in the trenches. I mean, I'm not in the trench, but I'm standing outside the trench watching what's going on, and it's not good.
So how do we fill that crack? I think that's the big question. And I think what Rhode Island has done well is be able to be creative and innovative in programmings to address that. So I know I can speak from the recovery center, the East Bay Recovery Center, that we have contracted with 2 accountable entities, one in behavioral health, federally qualified behavioral health centers in Rhode Island, and one with Prospect Health primary care physicians, where we're trying to fill that gap. And so when someone has that weight or going through there, we can add some type of support that's going through until we get them until the next appointment to get the services that they need. So there is like little pilot programs that's starting to address that, but how do you address the big problem of those wait lists in there, and how do we recruit more people to provide the services? I think that's the bigger question.
Yeah, well, we're going to take a quick break so I can pay the bills, so we can have another year. This is season 3, so we'll be right back. You've been watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
Now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Kathy Schultz and Tommy Joyce are in the house today. Welcome, and thank you for joining me today. I want to talk a little bit about recovery. This is Recovery Month. It's September 18th that we're taping, 19th, I think. The rally was yesterday. Big crowd. What's next?
Right now, we just still celebrate recovery. It's Recovery Month. So, we had the kickoff rally in the beginning within Warwick City Park, where there was a walk, a small get-together. And then on the 10th, we had the Bristol Rally for Recovery with, kind of bringing attention to some of the issues, but also letting people in the East Bay know that their recovery is out there and resources. And then the main rally was yesterday. Was in Providence downtown in the Providence Innovative Park, I believe that was the
Industrial
yeah,
Park.
Industrial Park, and it was a great event. You know, I could estimate around 5,000 or 6,000 people were there yesterday as a guesstimation, and as a those events are putting a face to recovery, because a lot of people, when they think about recovery, they think about the downside and the negatives, but they don't see what happens when someone enters recovery. You know, I would say this is what recovery looks like, and what recovery looks like, and you know, for me, I love Recovery Month because it's a family event. You know, usually if you see me at a rally, you'll see one of my children with me or my family all the time, and you know, and I'll tell you, like, my son has been involved for years with setting up the rallies and being there, and you know, I was surprised this year he took a day off of work, and he wanted to spend the day with me at the rally.
Nice.
And I think that's what it's all about. It's a celebration, letting people know that there's a robust recovery community, and we go out there and, you know, we're your neighbors, we're your friends and family. And I think it was yesterday was Tom Cordair from SAMHSA talked, and it said that, you know, there's 59 million people identify as being in recovery in the United States. That's a lot.
That's a lot of people.
You know, we do.
A lot of people.
And we vote.
Yeah.
That's an important piece too. So, you know, Recovery Month is about, you know, letting people know that recovery is not only possible, it's a reality, and that you're not alone.
You know, I watched Sheldon Whitehouse speak yesterday about the piece of legislation that he put in. I mean, we had conversations a couple weeks ago because he's putting in another bill this year. I mean, whether you like Sheldon Whitehouse or not, the recovery community loves Sheldon Whitehouse. With the stuff that he brings forward, he gets it. He's not there just because it's an election year. It's not an election year this year, but he was there. And he has a soft spot in his heart for people that suffer. And that 59 million people is a huge number.
Yeah.
It's a huge number. So people need to start thinking. You know, when I got into this business, it was 1 in 5 folks. Now we're down to 1 in 1 in the family, you know. And I mean, it's not getting any better. There is more opportunities for people to get treatment. The access to care is a little bit of a problem. There's a wait. You know, the stuff that keeps coming over from overseas is coming in by the boatloads. And these people that make the stuff that people are dying on it, that's all they do. They have all day to think about how they can make their product better. And you indicated earlier, Kathy, about the xylazine. I mean, if I was to put a picture up and have people look at what xylazine is doing to people, they would be horrified, as we all know. I mean, it's really a damaging mix with fentanyl.
Right.
Well, the way I look at things is, I say this all the time, it's the law of supply and demand. So law enforcement, they deal with the supply.
Yeah.
What we deal with is demand, human
Right.
beings.
Right.
So in the recovery community, we want to know why you feel so uncomfortable that you have to use something artificially to feel comfortable. And that's what we wrap around on, because
Right.
we truly believe that the opposite of addiction is connection.
Yeah.
And that's what Recovery Month's about, and that's what these rallies are about,
Yeah.
is making that connection to realize you're not so alone, and maybe sharing some of our life experience to know what we did to feel less comfortable in the pathways that we took. And then we basically sell hope at that point in time to
Right.
know that your life can get better.
So,
Are you just excuse me for 1 second? Are you seeing a better response from the police in the communities that have to deal with these folks and the combativeness and some of the other stuff that's happening? Are you seeing a better understanding of the issue?
so what I can speak to is that we do know that there was a pilot that happened that Sheldon Whitehouse actually speaks to often in West Warwick with the behavioral health navigator who was in West Warwick a few years back, who was providing not only going out and following up and working after an overdose, but also working within the police department to help the police officers to have a better understanding of substance use. But to speak to recovery itself is, you have to remember, I came into recovery 20 years ago. So 20 years ago, it was very, very different than it is now. And I can tell you, it may not seem that way all the time. There actually is more access to treatment. There actually is more access to recovery supports. We didn't have peer specialists at that time. None of that existed. It was really very much kind of in the basements, and we didn't really talk about it. But I want to say that, you know, when we think about the 50 million people that have substance use disorder, they're in recovery. Like, and I just want to remind everybody that this is Recovery Month, and that recovery is all about, breaking down those walls of social isolation. And what we did see with COVID-19 was there was massive isolation because of the pandemic, and it was out of all of our controls. As a person who has been doing this personally for 20 years, and me needing to, be with my people, be with my recovery community, I wasn't able to physically be with them. And that hug and that handshake and that it's going to be okay and that physical connection was kind of lost. And I think that that's what we're seeing right now, is we're seeing that lack of that social connection. And now we're in the recovery space of this, of trying to build that, and it's changed, right? And I'm just hoping, that the folks that are in my personal recovery community, they have been my strength. They have been the people that have held me up, and the pathway to my recovery has been that strength that has kept me here to this day. And what I try to do, even in my work as the director of the Governor's Overdose Task Force, I'm looking at all the pillars. I'm looking at the entire continuum of care and trying to look at each gap that may exist, or each success that may exist. But what I also want to just remind everybody is that this is a continuum, and recovery is not linear. So people are going to, it could be up and down.
Right.
But going back to what you're saying about the drug supply is much more toxic than it ever was before. So we do need to continue to get the resources that are specifically for things like fentanyl with xylazine in it and things like that.
All right, we got to take another quick break so I can pay the bills again. We'll be right back. You've been watching Recovery TV, and I'm your host, Sean Tassoni. We'll be right back after these messages.
Now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, Sean Tassoni. Kathy Schultz and Tommy Joyce are my guests from the Governor's Overdose Task Force. So, ladies and gentlemen, thank you for joining me today, and thank you for what you do. And I'm very proud of both of you that you've been in recovery for many, many, many years. And this program is the voice of hope, and you two guys now are the face of hope. So let's talk a little bit about the task force. We only have a few minutes left. Tell me the plans, site. What do you got?
You can start it off, Kathy.
So I do know the Governor's Task Force, as Tommy always mentions, he actually does a head count while we're kind of doing the logistics behind the scenes. It averages anywhere from 170 to 200 people a month. It is one of the biggest state convening meetings, and I'd like to really emphasize that it's really a community convening meeting. It is a meeting where the community all comes together, whether it be people with lived experience, people who are clinicians, the prevention coalitions, state agencies, and we all come together, and we're all there for a common cause. And the common cause is to save lives and to improve people's lives.
And I think it's important to know too, anybody can jump on board. You tell us where we can find that information so whoever's watching the show.
Yeah, so you can find all the information on PreventOverdoseRI.org. You can go and push the link for the task force. We have 11 work groups as well that anybody from the public is more than welcome to join us.
Yeah, really, it takes a village. Yeah. And so collaboration is key, and community is key. And I think the task force and the governor kind of really listened to the community by hiring Kathy as a director, and I was honored to be the community co-chair, we're going through, but it's the voice of the community that's the most important, because we need to know what's happening and what's going on there. And I'm always amazed at the meetings when it's 170 people coming together to just, with one main goal is to reduce fatalities. And to me, I think it's a beautiful thing that everyone's working together for that main cause too.
Well, I got to tell you, the Governor's Task Force is in good hands with you too. Thank you for joining me today.
Thank you, Senator.
You've been watching Recovery TV, and I'm your host, John Tassone. We'll see you next week.